Have you heard of achondroplasia? Well, if you haven't, you're about to find out. And if you have, you're hopefully about to find out more. We were wondering if Midwestern students have heard of achondroplasia. So, we're gonna go ask them. Let's go!
Hey, can I ask you guys a quick question?
Oh, sure.
Okay, do you guys know what achondroplasia is?
Yes. Is that one of your cartilage breaks down?
It does have something to do with
Or
cartilage.
like it alters the cartilage.
No, it's like, yeah, it's just like,
Altered cartilage.
Did you guys know achondroplasia is the most common type of dwarfism? Any Game of Thrones fans here? Tyrion
Yes.
Lannister?
Yes.
Tyrion Lannister.
That
Yes.
explains why.
Hey, can I ask you guys a quick question? Oh, yeah. Do you guys know what achondroplasia is?
isn't that has something to do with cartilage? What'd you say? Dwarfism.
She knows!
Oh, she knows.
Yeah, okay.
Because of cartilage.
Yeah, cool. Okay, thanks, guys. Do you know what achondroplasia is?
What's up, Josh?
Oh, hey, man.
Nice. By the way, do you know what achondroplasia is?
No, I don't know what that is.
You don't know? Let me tell you about it. Achondroplasia is a genetic bone growth disorder which results in a reduced stature and several skeletal deformities. Here's a brief video clip by osmosis.org describing the pathophysiology of achondroplasia.
In HBO's adaptation of Game of Thrones, the character Tyrion Lannister is treated poorly by his father and siblings because he's born with dwarfism. In a classic scene in the show, he says,
I'm guilty of being a dwarf.
You're not on trial for being a dwarf.
Oh, yes I am. I've been on trial for that my entire life.
both Tyrion and his real-life counterpart, Peter Dinklage, have achondroplasia, an autosomal dominant genetic condition which is the most common cause of dwarfism and results from a heterozygous mutation in a gene called FGFR3, or fibroblast growth factor receptor 3, on chromosome 4, which codes for the FGFR3 protein. When FGFR3 protein binds fibroblast growth factors, or FGFs, it slows down the growth of certain bones. The mutation causing achondroplasia is almost always the 380th amino acid, which is glycine, getting swapped out for arginine in the FGFR3 protein. And this swap causes the FGFR3 receptor to be constitutively active, which means constantly active. In other words, the mutation makes the receptor behave as though it's binding an FGF, even when it's not, which sends a strong signal to inhibit bone growth.
Achondroplasia is diagnosed by prenatal ultrasound, genetic testing, imaging, or a combination of the three. Many patients with achondroplasia may choose to undergo physical therapy, and it is important that the therapist understand congenital deformities associated with this disease as well as the implications. Specific structural deformities associated with achondroplasia include varus deformities of the knee, an exaggerated lumbar and cervical lordosis, an enlarged head, and disproportionately short arms and legs, as shown in the following images. In addition, due to a smaller rib cage, patients with achondroplasia are at risk for developing chronic pneumopathy. This may cause the patient to become out of breath more easily, which the therapist must be aware of during exercise sessions. The PT should encourage the patient to take breaks and speak up if and when feeling out of breath. Patients are also at increased risk of developing OA and DJD due to the atypical structure of the skeletal system. Therapists are able to teach compensatory movements to lessen the likelihood of OA and DJD development, as well as play a major role in the rehabilitation of any corrective surgery. Due to an increased cervical lordosis, people with achondroplasia are also at a higher risk of developing cervicomedullary compression. This can cause neurological issues. If the patient exhibits any neurological symptoms, the PT needs to refer the patient to a physician. To learn a little bit more, let's watch an interaction between a doctor and a mother who just found out her son was diagnosed with achondroplasia.
Come in.
Hello, Mrs. Chow.
Hello.
I'm Dr. Sandy.
Nice to meet you.
I have your son's lab results, and I came to a diagnosis.
What is it, Dr. Sandy? Tell it to me straight.
Well, your son has achondroplasia, which is a common form of dwarfism.
How did this happen? Neither myself nor my husband has achondroplasia.
In most of these cases, 80% of the time, both parents don't have achondroplasia, and due to a mutation, it's seen in the child.
So my son's going to be a little person. What's wrong with him, and how are we going to fix this?
Well, this mutation causes your son's bones to stop growing earlier in development, which will cause him to be shorter than his peers. In terms of treatment options, there is HGH treatment, but hasn't been significantly proven to improve the growth, so I couldn't recommend that treatment at this time.
Okay, what exactly does this mean for my son, and is he going to be okay?
Well, your son, currently the prognosis is pretty strong for him. You just need to be aware of any complications that could occur that may need surgery.
Okay, what exactly are these complications?
In most cases, there can be a lot of spinal complications. So any excessive bending of his spine, which we call kyphoses or lordoses, that could be corrected with surgery. He also will likely have bow-legged legs, and they also have osteotomies, which we can perform to correct it. But usually it's a very benign condition and doesn't need treatment.
Thank you for your help, Dr. Sandy. I was really worried at first because I didn't know what was wrong, but after you told me about it, I feel a lot better now.
Now that you know a little bit more about achondroplasia, here are some suggestions of what to do and what not to do if you happen to meet a little person.
I can't reach it.
What do you mean you can't reach it? Try harder.
I can't reach it.
Do you need any help?
Yeah, can you get that for me?
Yeah, sure. Sorry I put it so high. I'll find a better spot next time.
Thanks. Hey, have you started studying for that kinesiology/biomechanics exam?
No, I don't need to study. It's gonna be so easy.
Oh, hey dude, look over there. There's a midget.
Oh, wow. No way. I didn't even know midgets were real.
It's so short. Hey, have you started studying for that kinesiology/biomechanics exam?
No, I don't need to study for that. It's gonna be so easy.
Yeah, that's what I'm thinking too.
He's an angry elf.
Look at you!
Hey everyone, here to announce baby Jackson. He was born on May 12th at 8 o'clock. Coming in
9 pounds, 1 ounce.
9 pounds, 1 ounce.
Now that we've learned about how to interact with little people, let's take a look at an interview with actor Peter Dinklage. Here he talks about living with achondroplasia and how people treat him in his everyday life.
You know, too many people treat me with kid gloves. I don't like that. Like, they're cautious about choosing the right words, about looking you know, you have people that are like, yes, yeah, you know, they kind of like, and I know those are guys that were raised like with their parents, and they're pointed at me as a kid. They're like, no, look the other way. Because I see adults that are like, you know, uptight, and that's not good.
We hope you learned something.
Thanks for watching.